This video is going to demonstrate a few positions, 3 in particular, of using an assisted hand on top of the other and through the shoulder, side, down the side, and across in the lateral border of the scapula. Okay, so in the first step that we're going to do is how to get the access to the anterior portion of the shoulder. The bottom hand typically needs to be somewhat soft. There is a certain amount of contraction, so it's stiffness in the hand, but not a lot, a nominal amount. It's the top hand that is actually going to deliver most of your power. So it goes on top while the bottom hand stays fairly soft. And then as you pull back, your speed needs to be slow, or at least matching what tension is in the shoulder. If you go too fast, it'll twang underneath you, and it'll flip. It'll underneath and get away from you. If it does that, you have 2 options. First option is to slow down what you're doing. Second option is to lighten up, or do both. Yes? So another point in order to apply this effectively and to get the depth without putting a lot of stress on yourself is to look at the extension of my arms. They're fairly straight, but also look where I'm leaning. I'm taking it back and letting my body do the pull. I'm not pulling from here, but rather I've got the length and I'm allowing my body to do the pull. So in all these actions, it's more about letting your body do the movement rather than stressing out your hands to do it. And if I want to take this and put it to the side, I'm just going to take Stuart's arm, and so for demonstration purposes, just to allow to show you exactly what's going on. But he can keep his arm up there if he chooses. So one hand is on top, the other one is soft, but just a slight contraction coming here, lifting, pulling. The idea is not to take them off the bed, but to just do enough connection, enough lift that you're getting the tissue and not rotating the torso. Okay? The third position that you can do in order to access the lateral border is take it up to the top here and get underneath. It's same thing. I'm keeping all my technique. My arms are lengthened. My body's doing most of the work. My top hand's doing the power. My bottom hand is soft. And pulling through, just meeting the tension in the tissue. The important thing that I'm doing here is that I'm keeping my position, my hips behind the movement. I am not here doing a movement. I'm directly behind. Everything I'm doing is directly behind what I'm doing. And you will have a lot more power and a lot more ease and less stress on your body if you keep that principle throughout all your techniques. Thanks for watching the video.